Alzheimer's disease is a brain disorder that slowly destroys memory and thinking skills. Over time, it can make it difficult to carry out even the simplest tasks. It's the most common cause of dementia, which is a general term for a decline in cognitive abilities severe enough to interfere with daily life. Alzheimer's disease affects the brain by causing abnormal changes to certain proteins. These changes can form plaques and tangles in the brain, which disrupt the communication between brain cells and eventually lead to their death. As more and more brain cells are damaged, the brain shrinks, and this is what causes the symptoms of Alzheimer's. Alzheimer's disease typically progresses in stages. In the early stages, a person might experience mild memory loss, like forgetting recent conversations or events. As the disease advances, the symptoms become more severe. This can include confusion, difficulty recognizing loved ones, trouble with language, and changes in mood and behavior. In the later stages, a person with Alzheimer's may need help with basic activities, like eating and dressing. Now, what causes Alzheimer's? We don't know exactly why some people develop Alzheimer's, but researchers have identified several risk factors. 1. Age. The biggest risk factor for Alzheimer's is getting older, especially after age 65. 2. Family history. If a close family member has Alzheimer's, your risk may be higher. 3. Genetics. Certain genes can increase the likelihood of developing the disease. 4. Head injuries. A history of severe head trauma might increase the risk of Alzheimer's later in life. 5. Heart health. Conditions like high blood pressure, high cholesterol, and diabetes can increase the risk of Alzheimer's, as they affect the blood vessels in the brain. The most common early symptom is memory loss, especially forgetting recent information or events. Other signs might include difficulty solving problems, confusion with time or place, trouble with words when speaking or writing, misplacing things, and changes in mood or personality. Unfortunately, there's currently no cure for Alzheimer's disease, but there are treatments that can help manage symptoms and improve the quality of life for those affected. Medications can help with memory loss, and therapies like occupational therapy can make daily activities easier. It's also important to have a strong support system, whether it's family, friends, or a caregiver, to help navigate the challenges of living with Alzheimer's. If you have a loved one with Alzheimer's, here are a few tips that might help. 1. Be patient. Alzheimer's can be frustrating for both the person with the disease and their caregivers. 2. Create a safe environment. Make sure their living space is safe and easy to navigate, with clear paths and minimal clutter. 3. Stick to a routine. A regular daily routine can help reduce confusion and anxiety. 4. Communicate clearly. Use simple words and sentences, and try to stay calm and reassuring. 5. Take care of yourself. Caring for someone with Alzheimer's can be emotionally and physically exhausting, so don't forget to look after your own health and well-being. Alzheimer's disease is a difficult journey, but with the right support and care, people with Alzheimer's can still experience moments of joy and connection. If you or someone you know is affected by Alzheimer's, know that you're not alone. There are resources and communities out there to help. Join the WellnessWave community for more tips and support on your journey to wellness.